Now, you wouldn't want to buy a home or car without shopping around. So why are you expected to pay for medical procedures without knowing the price? A year ago, a federal law was put in place requiring hospitals to be transparent with their pricing. But new research shows a majority of hospitals are not fully complying with the law, including many in Idaho. CBS2's Ariana Piper is live in the studio to explain.
These non-compliant hospitals are making millions of dollars and leaving patients in the dark. I wanted to find out how Idaho hospitals measure up and how many of them are transparent about costs. PatientRightsAdvocate.org is a nonprofit that tracks hospital pricing transparency and pushes for compliance. In a new study, the nonprofit found that most hospitals in the United States are not fully complying with the law. That includes those here in Idaho. Hospitals are required to be upfront with all of their pricing, which allows patients to shop around, which in turn lowers the cost of healthcare. Hospitals are required to post the actual prices, secret contracted rates, and discounted cash rates. Of the 1,000 total hospitals reviewed, the nonprofit found only 14.3% were complying with the transparency rule. The study reviewed 12 Idaho hospitals, including St. Alphonsus, St. Luke's, and West Vale. The hospitals were judged on 11 categories of price transparency. St. Alphonsus scored better than the other two local hospitals, but failed to provide sufficient pricing information for negotiated rates. The study found St. Luke's omits de-identified negotiated minimum and maximum standard charges and all negotiated rates by payer and by plan. West Vale failed to admit the same details as the other two hospitals, and also had an incomplete or overbroad item descriptions, and used calculated estimates in place of numerical prices. In a statement, West Valley Medical Center says, the federal regulations require hospitals to post a shoppable, consumer-friendly list of services or a price estimator tool, and provide a machine-readable file containing 5 types of standard charges. Over the last year, we have worked diligently and have completed our implementation of these requirements. Our hospital website has a consumer-friendly patient payment estimator tool that provides relevant information to help patients understand what their out-of-pocket costs may be for hospital care, including for patients who are uninsured. In addition, we have posted contracted rates with third-party payers using one of the machine-readable file formats listed in the regulations to provide the 5 types of standard charges. The 12 Idaho hospitals were reviewed by this nonprofit in either 2022 or 2021. To view the full compliance document, make sure to head to idahonews.com. Live in the studio, Ariana Piper, CBS 2 News.
Well, this afternoon we heard from St. Luke's. The statement says in part, St. Luke's fully supports price transparency and views it as a way patients can be involved in their health care. The statement goes on to say that St. Luke's has an easy-to-use price estimation tool to help estimate the cost for the most shoppable services. St. Luke's says its pricing is in line with other healthcare organizations in the community. And we also heard from St. Alphonsus. They sent us a statement this afternoon. It says St. Alphonsus takes compliance with all regulatory requirements, including federal price transparency laws. Accordingly, our website offers patients options to determine the estimated out-of-pocket cost for a medical service or procedure. St. Alphonsus says in its compliance with federal price transparency laws and invites any patients with questions to contact the hospital in their community. To read the full statements from St. Luke's and St. Alphonsus, go to idahonews.com.